Okay, let's wait and let's wait. Let others join. Mm. Okay, who do we have here? You are highly welcome. Simply Neddy, thanks for joining me. Thank you. Can you let me know if you can hear me? Please, can you hear me? Sadiq Musa, you're welcome. Income Push Hub, you're welcome. Thanks a bunch for joining me. Let's wait for like a minute or two for others to join before we proceed, please. Thank you. Thank you. All right. Yeah. So great. We are good to go since you all can hear me. Thank you again. I'm grateful. Thanks for joining my live today. Thank you so much. So this is 4 minutes past 3. We are going to wait for like a minute or two. Yeah. When it's like 6 minutes after 3, we continue. Thank you. Thank you for joining. Okay. All right. You are highly welcome. Welcome to my live. Thank you really so much. I appreciate. It means a whole lot you joining me today. So my channel actually I talk about everything that has to do with when it comes to taking care of your babies, like how best to go about it. I dish out informations, right? So especially expectant moms, first time moms. Well, no knowledge is a waste, they say. So even you have done giving birth, there might be one or two that you can learn because nobody knows all. So in the course of my conversation, you never can tell one or two that you might be able to pick and also share it with other people that will need the information. So on today's live, I would like us to discuss something very, very important and it's so crucial to the lives and development of babies, right? So personally, I don't have problem with treating kids, especially infants. I don't have problem, right, with treating babies, or should I say, I don't have problem with traditional way of treating ailments or illnesses in individuals. However, I have some reservations when it comes to. I'm so sorry, please. So I'll be doing this. I'm home alone with my toddler. So this kind of distraction, I was actually expecting it. So please forgive me while I attend to her. Thank you. I'm so sorry for this, please. Yeah, yeah. Take, go, 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 go. Take, go and give Teddy. Take. Bye. Go and give Teddy. What, Daddy? Go. All right. I'm sorry for that. You understand, right? So like I mentioned, I don't have problem with traditional way of treating some ailments and some sicknesses or diseases. But when it comes to infants and toddlers, especially infants, right, I really have a whole lot of reservations because they are, what's it called now? They are just developing and their intestines are still very fragile at this stage. And ingesting anything into them is not safe because some important organs like their intestines, their kidney, like their liver, their kidney, get to suffer a whole lot. That you might not really see the effect at the moment as at when you are doing that, but in the nearest future, it will manifest. Here's the reason why, in my opinion, parents, mothers should not indulge in the use of herbals at early years or early stage of children's life. And that is why today we'll be looking at jaundice in babies. Jaundice in babies. Like some people take it to be something that is so like it's a trivial something like so really if jaundice is left untreated in babies, the consequences at the end of the day is not a funny one, right? So that's why I think today I will take my time and create this awareness. Hello, 50 and beyond. You're welcome. Hello, Aisha Yetunde. Thank you so much for joining me today. Thank you. Juliana Aisha, thank you. Thank you. Thank you so much for joining. And so I think today I should share this or create this awareness about this jaundice. Mothers, like, they need to know. Don't take it lightly when you notice it. And that is why I put some things in place so that I'll tell us what is a jaundice. Then we'll know the types of jaundice and what are the causes of this jaundice in babies. Then what are the symptoms as a mother after you gave birth? How do you dictate jaundice in your baby? Should in case it happens. Then lastly, which is most importantly, how do you go about the treatment of jaundice in the event it turns out to be your baby have a jaundice? All right. So what is a jaundice? Here with me is just short definition. Jaundice is the yellowish discoloration of a newborn baby's skin and eyes. Yellowish discoloration of a new baby's skin and eyes, because majorly these are the two places you get to notice when a baby have a jaundice. Like you get to see the baby's eyes, like that the white what's it called now, the white area in the eyes that's supposed to be white. Some babies you see theirs, it will be yellow. I'm so sorry for the disturbance background. It's really my baby. Stop that. Take. I'm sorry. Go and give Teddy. Go and bring the other one for me. Thank you. Stop eating it on the floor. All right. So, like I mentioned, yellow discoloration of the baby's eyes and skin. These are the two places you get to notice when a baby have a jaundice. You tend to see that the eyes turns out to be yellow. Then the skin also, especially those of them that are light skinned, right? The skin in babies that are dark in complexion, you hardly notice it. However, in babies that are light skin, it's very obvious. Like you don't need to be told. Once you see the baby's skin, you will know that this baby have a jaundice. So that is what a jaundice is. Now, how many types of jaundice do we have? There are two types of jaundice. We have the physiological jaundice. This type of jaundice is not caused by disease at all. So know this. The baby is just being born with it. It's not nothing triggered the occurrence of this type of jaundice, which is the physiological jaundice. Then the second one is pathological jaundice. The second one is pathological jaundice, physiological and pathological jaundice. So if the first one, which is the physiological jaundice, is not caused by a disease, then the second one, which is the pathological jaundice, is caused by a disease. So we get to uh, look into that in depthly much later. So, what are the causes of jaundice? What causes the jaundice then? If one of it is caused by disease and the other is not caused by disease. So let's get into it. Jaundice is caused by too much bilirubin in the blood, also known as hyperbilirubinemia. That is the cause. Too much of bilirubin in the blood of the baby, which is also known as hyperbilirubinemia. Now, so what is this bilirubin then? Is a yellowish substance or a pigment, right? Produced when red blood cells, which carry oxygen around the body, are broken down. So that is what the bilirubin is. Now, this bilirubin, that's the yellowish substance, it travels in the bloodstream to the liver. From the liver, it changes the form of the yellow substance. It's after changing it, it changes after changing the yellowish substance, so it can pass out of the baby's blood through the baby's poop. That is how it ought to be, right? It passes through the baby's liver. The baby's liver more like convert it now, right? In the course of more like digestion process, then it now turns out to be a waste through which the baby will now pass it through the baby's poo. But however, where this is not being done, the yellowish substance that is still that the baby is unable to pass through the poo, that is what causes the jaundice. That is the bilirubin, which is the yellowish substance. Excuse me. Stop that. I'm going to beat you. Take you. All right. So, however, when there's a high level of the yellowish substance in the blood, like I mentioned, and the baby is unable to pass it, right? The liver cannot get rid of it. If there's so much amount of that yellowish substance, the liver cannot get rid of it, then the excess amount of the yellowish substance turns out to be the bilirubin, which causes jaundice. I hope this fact is well established. Now we know what a jaundice is. Now we know the types of jaundice and what causes it. Now, so another cause of the jaundice is called pathological jaundice. The former, which is the physiological jaundice, is the one we just looked at. Now, the second type is the pathological jaundice, like I mentioned. This jaundice is caused by a pathological jaundice is caused by, or caused rather, as a result of blood group incompatibility. When the mother's blood group and that of the fetus or the baby are not compatible, pathological jaundice is bound to occur in the babies. Now, between the mother and the baby, when the blood group is not compatible, right? The baby's blood and that of the mother get mixed up in the course of pregnancy and during birth, and that will automatically turn or make the baby to have a pathological jaundice. So another cause of pathological jaundice is rhesus disease. This occurs when the mother rhesus has negative blood and that of the baby has positive. So like I mentioned, is still going towards the direction of incompatibility. Another causes of pathological jaundice is sepsis, right? Sepsis is an infection in baby's blood. Another cause of a pathological jaundice is liver malfunctioning. Liver malfunctioning. So these four types are what can lead a baby to have a pathological jaundice. Okay, so let's continue. What are then the symptoms of this jaundice? How do I get to know? Like, I just put to bed, I'm there with my baby. How do I get to know that my baby have jaundice? Right? What are the symptoms? Like, what will make me know that this baby have a jaundice? Now, actually, like I mentioned from the beginning, from the definition of the jaundice, which we mentioned is yellow discoloration of the baby's eyes and the baby's skin. So these are the two ways you'll be able to know that a baby have a jaundice, through the baby's eyes and through the baby's skin. Now, so the number one is the baby's skin turns yellow, yellowish skin, and the second one is the white part of the eyes also becomes yellow. So these are the two symptoms that will indicate that a baby or an infant have jaundice. When you look at the baby's eyes, instead of this white, what's it called? The white part of the eyes that we have, the baby's on tends to be yellow, and the baby's skin, especially like I mentioned, if the baby is light skinned, once you look at the baby's skin, it's yellowish rather than being this fair complexion, so to say. So, when can jaundice then be detected? Having to know the symptoms, the types, the causes, and what it is. Then, when can jaundice be detected in babies? Is it that as soon as you're put to bed, right, like immediately, even right from the labor room, already the nurses are telling you, the midwives are already telling you that your baby have jaundice, or the following day, or like, you understand, is it in an hour, 24 hours, in a week, a day? When can jaundice be detected in babies? Jaundice can be detected, or it usually appears between second to fourth day after birth. So watch out for these windows. After a mother must have put to bed, most times the first day you don't get to notice it. But from second day to the fourth day of the baby's life, right, you can dictate if the baby have jaundice or not. So like in Nigeria here, right, there are some hospitals, after you put to bed, if it is not through CS, some hospitals, like I know some hospitals, in less than 24 hours, if you are being observed and you're good to go, no any kind of complication, like after they just assess you and see that you are good, maybe in about 8 to 10 hours, yeah, they will discharge you. So you will leave the hospital without seeing these symptoms. You won't be able to detect it if you leave the house. However, for mothers, they usually give birth through CS, which in some hospitals they get to keep you for three minimum of 3 days, and up to period of 7 days if there's no complication. Minimum of 3 days and up to 7 days, you get to be discharged. So during this period or number of days that you are still in the hospital, while they are reviewing, still assessing you, there's every possibility that if your baby have a jaundice, then the nurses will be able to the nurses or the doctors, right, will be able to help you to detect it if you are unable to do that by yourself. So these are the number of days jaundice is expected to appear or showed up, which will help you to dictate it if or not, whether or not your baby have jaundice. Now, there's a simple technique, or should I use the word hack, right, that will help you to dictate whether or not your baby have a jaundice. So maybe your baby is not all that light skinned, and maybe the discoloration of the eyes is not all that obvious, right? So you are left with little or no clue to dictate whether or not your baby have a jaundice. There's something you can do as a mother to dictate if a baby have a jaundice or not. And number one is this. So from that day two, I probably sorry. So from the day two to day four, you can actually check like I mentioned. And this is the first technique or hack to make use of in order to detect if your baby have a jaundice. Number one is you use your finger, right? The baby's nose. On the nose, just press the baby's nose like just like the way I am doing. Now you get to discover that any part of the body that you press, Jesus, please excuse me again. Hey, stop that. Give it to me. Let me have it. Go and bring it. Go and bring it. Get it for me. Go and bring it. All right. Sorry about that. So you get to know that any part of the body, once you press the part of the body like this, um, the blood circulation around there temporarily will cease, and the place becomes a bit kind of white, so to say. So that also can help you in detecting whether or not a baby have a jaundice. Whether or not a baby have a jaundice. Just press the baby's nose, like this part of the nose. You press it for some seconds, not too hard, not too hard. God. After pressing it, you release it. Now, before the blood flow comes back to that place, if that baby have a jaundice, you will be able to detect that this baby, oh Jesus, have a jaundice. Please excuse me a moment. I'll come and continue. Let me stop this girl from what she's doing. What is your problem? Give it to me. Go and do the baby here. Come, see baby, baby. Go and do baby. Train, movie. Take, take. Go and write two. Take. Go and write for me. Write your name. I'm so sorry. I apologize. I'm really so sorry. Like I mentioned, it's just the two of us at home now, so nobody to help me with that. All right, so I'll continue. So that's the first way to know if a baby have a jaundice or not through the baby's nose. Now the second one, right? The yellowish after like the forehead. Again the second one is the forehead. This part of the forehead, you press it too. You know, at this point, it's still very tender. It's still very tender. So just press it a little bit and it will go down, and the blood that is around there will kind of, the circulation around there will cease a bit. And release your hand or finger. Once you release your finger from the place, you get to notice this yellowish color around that particular spot where you placed your finger. So as a mother, take note of these two things. These are the simple ways through which you can dictate at this early stage of the baby's life whether or not the baby have a jaundice. Okay, so moving on, we've now looked at the symptoms and how you'll be able to dictate if your baby have a jaundice. The next will be how then can jaundice be treated? How then can jaundice be treated? Now, jaundice can be treated in the hospital, of course. And oh, good God, I'm sorry. Please forgive me. Take. Yes, go and talk to Divine. Say hello to Divine. Say hello to Divine. Say hello to Divine. All right. I'm sorry. Sorry. I'm really sorry for this distraction. So, like I mentioned, how if you're able to detect and know that your baby have a jaundice, The right thing and the proper thing to do is not to stay at home and start posting on either Facebook or any group that you belong to, seeking for treatment from people that knows little or nothing about jaundice. Like you get to hear about some people telling you morning sun, that early in the morning, bring the baby out and let the baby face the morning sun. When the sun is rising, let the baby face the sun. Another school of thought will tell you that when your baby have a jaundice, you get unripe pawpaw, you boil it. I don't even give much attention or pay much attention to the details on how to go about it, but I know about these two that so many people have recommended to help in treating jaundice in babies. Like really, like I mentioned from the beginning, right? These babies' organs are just developing; they are still very fragile. So why would you take chances ingesting things that are not taken by them? Why? Right? So it is very important that when it happens or you discover it, please, the right thing to do is to take your baby to the hospital. That is the right thing to do. Get to meet with a pediatrician. Let them diagnose the baby. They will now run a test on the baby to know the level because jaundice are not the same. They are not the same. There are some with minimal treatment, off they go. However, there are some they have to be treated for up to number of days. Like there was this time we were in the hospital. My baby was she was still an infant then, so she was sick, so we admitted, and that was when I get to see the way jaundice is being treated, like putting the babies under the blue light and all of those. So I saw the way it was treated, and there was a baby. Yeah, I can remember vividly. The baby spent about 3 days. Yeah, the baby spent about 3 days under the blue light. The baby spent about 3 days under the blue light for the treatment. Now, as we continue, we are still going to look at, as we continue, as we proceed, we are still going to look at if you leave this jaundice untreated, what are the consequences in the life of the baby? Like, what can it do to the baby in the future? We are still going to look at that much later. So, this is how the treatment of jaundice is being done. The treatment options of jaundice includes one, phototherapy, right? Phototherapy treatment. It requires that the baby's skin is exposed to a special type of bright blue light. That kind of light I was talking about just now, right? So the baby's skin will be exposed because usually, yeah, those ones I saw under the blue light, they didn't wear anything on them. No, they were not wearing any clothes. They were not wearing any clothes. They just put them in the place, and the bed that is there it's not really like a foam. Not it's not a soft foam per se. It looks as if like a padded bag with some kind of liquid in it. That was how it looks. The one I saw, right? So under the blue light, the baby's skin will be exposed for as long as it takes for the jaundice to be passed out of the baby. For as long as it takes, the baby is going to be there. And again, like I mentioned, depends on the level of the jaundice in the baby. And of course, how do you get to know the level? Until the baby is being tested. So that is why it's very important for you to get to the hospital and not just at home and be asking people for opinion or what you can use to treat jaundice. So that's the right thing to do. Okay. So after the baby's skin will be exposed and they are safe. The blue light under which the baby is going to be placed They are really safe. Please pardon me. Take. Stop it now. Take. Take. No, 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 no. No. Go and watch Bluey. Go and watch Bluey. Bluey. Go, go, go. Oh, yeah, take. Okay, they are safe. They are totally safe. Safe. They are very, very safe for the babies. Now, what the light does is this: the light causes a chemical reaction in the baby's skin, which lets the body to remove the yellow substance more easily. And this can be done through it. The baby, like what the blue light is doing now, right? It will make the reaction causes the baby's body to pass out the remaining yellowish substance, which is still in the blood, and it does that passing through the liver, as I mentioned in the beginning, right, through the baby's either urine or the baby's stool. So the more the baby passes urine, oh God, the more the baby passes urine and stool, the more the substance get uh, is being reduced from the body. Now, until all the substances is being passed out, then the baby does not have jaundice again. Now, you would ask, for how long does my baby need to be under this blue light, or for how long does the baby need to be under the blue light? Go and carry it. For how long does the baby need to be under the blue light, right? The baby will be under the blue light. It can take from hours, like I mentioned, to days. It can be maybe 6 hours, 8 hours, 12 hours, like that, and to days. So, like I mentioned, it depending on the bilirubin level in the body, depending on the bilirubin level in the baby's body, that's how long the baby has to stay under the blue light. I'm so sorry, people. Please forgive me. It's one of those things. Let me, God have mercy on me today. All right. So that is how long the baby is, or the baby needs to be under the light. It could be for a number of hours. It could last in days. Like I mentioned, the ladies, the other woman whose baby I saw under the light, the baby was up to 3 days under the blue light. That was how long the baby stayed under the blue light. So it depends on the level of the bilirubin in the baby's body. So the baby passes it through stool, and it passes it through urine. Yeah. So that's how long the baby needs to be under the blue light. Now, which lead us to the next question, right? If jaundice is left untreated in babies, oh good God, sit. Go and write for me. Two, yeah, go and write. Write 2, 3, write it for me. Write your name for me. Okay, I'm sorry again. Yeah, the interruption is just too much, but what can I do? So we continue. If jaundice is left untreated, what are the consequences? So, what are the dangers of untreated jaundice in babies? Jaundice, when left untreated, can be serious, or even it can be life threatening. Yes, it can be life threatening. That's how serious it can turn out to be if it is left untreated. Hence the reason why, to be honest, like I mentioned in the beginning, when I saw, or rather, whenever I see this kind of post from mothers asking for home treatment of jaundice in babies. Like, I don't really take it lightly, to be honest. For some reason, I get to take it more personal because the fact that I have little knowledge or awareness about this very thing and what it can do, and what I read and heard from people that has experienced it, right? It's really not a nice thing to say you want to come on any social media platform for you to want to seek for how jaundice can be treated, because it's going to be trial and error at the end of the day, because thousands of suggestions or thousands of way or how to treat it, many people, it will just be flying. This one will dish out on the other one will dish out on the, like, here and there. One will say purple, one will say morning sunlight, one will say this, one will say that. So whose on are you going to follow? Like, whose on are you which of the recommendations do you intend to work with, and you think it's going to help you solve this problem, right? Sorry. Oh, yeah, sit. Take your take your straw. Leave it. Leave this one. Yeah, take your straw. Finish it. Finish everything. Good girl. So, right, whose one are you going to follow at the end of the day? That is why it is very important. The best and the right thing to do: go to the hospital. People that have knowledge about what this thing is, that can guide you rightly on the right path on how you can get the solution, get it from them to avoid hard. I know, like, I've always imagined, like, okay, as a mother, one of the prayer I always pray, right, to be, I'm being honest now, I would always tell God in prayer that, please God, do not allow my child to suffer as a result of my, or because of my ignorance. I'm like, I always ask God for that mercy. God should never allow me, because maybe I, what I'm supposed to have done the right time, I procrastinated doing it, and it eventually turns out to be something disastrous, God forbid, or something unpleasant. Do you understand that kind of a thing? So I always ask God that, God, please help me. Let my ignorance in any way not affect this girl. Like, for the sake of your mercy, let your mercy just speak. So, and that is why the ones that we are aware of, we shouldn't let it to be detrimental to the health of our babies, right? So, I will go ahead and list to us dangers of leaving jaundice untreated. Dangers of leaving jaundice untreated, because the longer it lingers, right, then the possibility or the consequences is going to be greater. Hi, what do you want? Take your own. Ah, people, I'm sorry. Oh. Forgive me, please. Here, let me tie this one around your neck. Like this. Fine girl. Oh, yeah. Yeah. See, baby. Baby. Mwah. Give baby a kiss. Okay. So, jaundice, when left untreated, it can be serious or even life-threatening if not treated promptly. So, like mentioned, it's one thing to detect it, it's another thing to sweep into action immediately by taking your child to the hospital. Stop touching this keyboard. Stop it. It's another thing for you, after detecting it, to go to the hospital for diagnosis, right? Then it's another thing entirely for you or for the jaundice to be left untreated in your babies for a very longer period of time. What it does is that the longer it stays, right? Sit down. I don't want you to fall. Okay, I should remove it. Yeah, 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 yeah. Take, go and bring Teddy for me. Baby, go get me that pen. Go and bring it. Go and bring one, two. Go and bring two for me. Go. Go and get it. Go and bring it. Thank you. Fine girl. Go on. No. Thank you. Oh, yeah, take your own. Right to baby. Mwah. Yeah, sit down. Well, I'm sorry. I anticipated this because she don't sleep by this time of the day, so the possibility of this happening was very high. So please, I'm sorry. It's unavoidable. So, like I mentioned, right, jaundice, when left untreated, can be serious or even life threatening if not treated promptly. So, underline the word promptly, like as soon as it's been detected, please do the right thing. So, it can lead to health issues such as one, brain damage. See, one of the dangers, it can lead to a brain damage in the future. So as a mother, I, I wouldn't like to use the word ignorance, right? Because especially for those people that usually come on Facebook and other platforms to seek for uh, ways through which they can help them treat the jaundice at home. So it's not an ignorance because already you know that this child has it. And the right thing to do when you discover that the child health wise is not doing well, the right place to go to seek for medication or the right place to seek for any kind of help should be the hospital, right? And so as a mother, how would you feel that in the future, because you neglected this in your baby and it now turns out to be this serious that the baby will now have uh, brain damage. So one of the dangers is brain damage, which can lead to cerebral palsy, or it can also lead to deafness. Yes, I should give you this. Yeah, take it. Finish it. Finish everything. Finish it. Oh, let's take it. Right to right for me. Right. Go and take your pill. Two, three. Clap, clap, clap. Go and write it. Go and write it for me. Thank you. All right. So brain damage, and when the brain is damaged, it can lead to the baby having cerebral palsy or even deafness. So see people, you see the reason why as a mother, right? As a mother, as a parent, an aunt, or whosoever you be, like whosoever you are to either the parent or the mother, especially since the mother most times is the one that gets to spend most much time with the baby. Please let them know. Let them know the consequences. Let them know the dangers. Let them know the consequences and let them know the dangers. That is not something that you just sit at home and say you want to do it by yourself. Take the baby to the hospital because share with them the dangers. Let them know that this thing can damage the baby's brain. Let them know that the baby can have a cerebral palsy. Let them know that the baby can have deafness, like the baby can be deaf if the jaundice is left untreated. So, in trying to draw a conclusion to the topic jaundice, what then or when do you need to see a doctor? When to see a doctor is when the baby is weak. Hmm? You just have a baby, probably from the day 2 or the 3 or the 4, and the baby start getting weak. It's a red alert, like it's a red flag that all might not be well with the baby. The baby that you just gave birth to, that one should look forward to the baby becoming stronger, but rather the baby is now becoming weak. It is the right time for you to want to seek your physicians, especially the pediatricians, attention. That's when to see a doctor. Number 2, when is the right time to see your doctor is when the baby becomes very fuzzy and very irritable. Like the baby is just there. You turn the baby this way, the baby is just fusy, crying. No matter how you try to pacify the baby, no matter how you try to cuddle the baby, no matter how the baby is not just getting calm, is another red flag. Is another indication which another indication which may mean that the baby might have a jaundice. Like I mentioned, it's still under probability yet. So the baby might have a jaundice. There are other illnesses that are attributable to the baby being weak, being fusy, right? Because some people would want to attribute especially fusiness to colic. It might not be colic at this stage. It might be a sign of jaundice. Then the third one is losing weight. So naturally, after you put to bed or after a baby is being given birth to, right? Um, they don't get to add weight. Like as soon as you give birth to them, as they grow, you expect that they will be adding weight. What's it called? Immediately. No, naturally, after giving birth to a baby, for some, for the first 2 weeks or less than, the kg you gave birth to them is not what they're going to do. There's going to be a drop. Some babies will drop. Maybe you give birth to a baby that is 3 kg. Within a period of a week or two, the baby gets to shed that weight and maybe becomes 2.8 or something. Then after that 2 weeks, you see the baby will now pick up, and then normally they now go on to keep adding their weight. So it's always natural this way. It's always natural that for baby after giving birth to them, for them to lose weight and again they pick up and continue adding their weight. So it's natural. But however, if losing of the weight lingers for longer than it should, is a big red flag. It might be an indication that the baby have a jaundice. So these are this is the right time to see a doctor. When you notice that the baby is getting weak, the baby is getting fusy and irritated, like by anything, and the baby is losing weight, these three things is not a good thing for infants, especially at the early stage of their lives. So you would want to see your physician. So beautiful people, my mothers out there, my first time moms, my prospective mothers, maybe you're just a first time mom about to deliver, right? Please watch out for this jaundice. It's not really a good thing if it eventually happens that your baby have a jaundice. It's not really a good thing. Like we have seen, like I mentioned earlier. Sorry, I need to bring this one in, man. Baby, sit. I'm always. What do you want? What do you want? What should I give you? Eh? What do you want? What again do you want? Eh? Take. Go and watch Bluey. Take. Hey, Bluey. Take. Take. Uh-huh. All right. I'm so sorry. So, like I mentioned, right? If you're an expectant mom, if you just put to bed, like you just delivered and you come across this live stream much later, or you have someone that might be in this situation right now as I speak, please do well to share this with them. Pass the message, pass the information, let them know what a jaundice is. Not necessarily even they must not even get to know about the causes and all of those, but it's just to for us to have a good foundation or background on the topic. That was why I had to go ahead to even give us the types of the jaundice, so that you even get to know that is not a disease that made your baby to have the jaundice. So we have learned that there are two types of jaundice in babies, which one is pathological and the other one is what's it called now? The other one is not caused by disease. So let them know that one can be caused by a disease and one isn't. Let them know that the right thing to do um after they gave birth, how they did, what are the symptoms they need to look out for in the baby, like the baby's eye turning yellow and the baby's skin also turning yellow, right? Those are the symptoms majorly. Let them also know, or let them also know that on their own from home, if it happens that they have been discharged to the hospital from the hospital, and they get to notice that the baby is displaying this kind of symptoms, there are things they can do on their own from the house to be able to notice whether or not the baby, or to dictate rather whether or not the baby have jaundice, like pressing the nose and the baby's forehead when after releasing your finger from those spots and you see that the area turns yellow, it then means that the baby have a jaundice. We also looked at how it can be treated, and like we mentioned, the right place to go when you notice that your baby have a jaundice is the hospital, not coming on social media asking for help. The right place to go is the hospital. Also, let them also know that it needs to be tested for the level of the jaundice in the body of the baby to be detected. So, and how long it's going to take for the baby to be treated depends on the level of the bilirubin in the baby's bloodstream. And the longer um, minimum of hours and number of days is how long it takes for the treatment to be done. And let them also know that the blue lights under which the baby is going to be placed for the treatment of the jaundice is completely safe. It's very, very safe. Like, oh yes, I remember there was a woman, the skin is so the way it is at the time she was asking the question. So it is very important to also know that the phototherapy, the blue light that the baby's skin is being exposed to, is completely safe. It has no negative effect whatsoever on the baby's skin. And lastly, we also get to we've looked at what are the dangers, share with them. Like, do not take this thing for a granted. Like, it can leave a lifetime danger in the life of your child if you do not attempt, or rather if you do not attend to it promptly, because it's one to detect it, it's another thing for it to be treated at the right time. If you leave it to linger for too long, let them know that it can cause a brain damage in the brain. And people of God, this is, stop it, you fall, come on. Oh, sorry. So take, call daddy, take, call daddy, take daddy, call daddy. Thank you. I'm sorry again. Please pardon me. Take, call daddy, talk to daddy. Okay, so like I mentioned, right, it can cause brain damage. It can cause brain damage. It can cause deafness. It can cause cerebral palsy in babies. So let them know that these are the dangers of jaundice in babies. Well, I don't know about you, but however, while making research on this topic, right, I really enjoyed it. Like, while I was pregnant, one of the things that I made sure I did, like, I turned semi doctor, or should I say use the word nurse, because I was always on the internet. I was always on every side that has to do with this, and just for me to make myself to be conversant, to get all of this awareness. So it's really an interesting topic, and the fact that the dangers and the consequences of it, if left untreated, can be deadly, can be life threatening. Hence the reason why I think parents, right, need to do more and pay attention when it comes to their baby's health. So, in conclusion, like I mentioned, I am not against traditional method of treating ailments and diseases, right? But however, in my opinion, when it comes to our infants, when it comes to our toddlers, like when it comes to our babies, please, we can do better. Let's take them to the right people that can diagnose the, like, people that can give you the right solution to the problem that is at hand, because sometimes you may know little or nothing about what the problem of those babies might be. But however, people that are trained professionally will help you with solutions to whatever it is that might be the problem with your baby. So, and that brings us to the end of today's live stream and today's topic on jaundice. For every one of you that has been watching my videos before now, thank you so much. I appreciate you. For your likes, I thank you. For your subscription, I thank you. For your comments, I thank you. And yeah, I get to see some shares here and there also. For everyone that has ever shared my channel. Until I see you again, keep watching my videos, keep supporting me. Thank you so much. Again, sorry for the distraction in the background. Like, I couldn't help it. I can do little or nothing. Hence the reason why it happened. So thank you so much. Bye. 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 I love you all. Thank you so much for everyone that supported me today. Thank you.